you have another is gastric phase, that is when the food comes to stomach, and third one is intestinal phase, when food reaches to intestine. So these are the phases, and because of that there are various neuronal and hormonal or what we can say endocrinal activities are taking place, and these activities play very important role. Second very important thing, you will notice that in physiology that there are certain protective factors are being released, and they are released because of one or other thing. If you can recall some of the things you have studied earlier, even in therapeutics as well as pharmacology, prostaglandin plays very important role. That prostaglandin is responsible for normal maintenance of the gastric mucus secretion and the bicarbonate secretion, and these two are protecting the mucosa of the GIT from ulcerations or problems of acid peptic diseases. Now, if this physiology is clear to you, then next thing I will suggest you to read inorganic chemistry book, where you have read various inorganic drugs, we will call them, or inorganic agents, example aluminum hydroxide, magnesium hydroxide, etc., calcium trisilicate. There are many inorganic chemicals, but I remember long back, almost 20-25 years, I taught for some days. I got chance to teach inorganic chemistry, though it's not my subject, but when I taught it, I realized very important thing which is related to this pharmacology of the drugs, that is how this aluminum hydroxide and magnesium hydroxide, they are playing very important role. They are causing and buffering activity, and they do not drastically change the pH. If they change the pH drastically, then there are problems. We call them, these are the adverse effect. Why sodium bicarbonate should not be used. You read this, if you have got any difficulty in this, we can have discussion. That sir, we have not got this, but you read it. Okay. So why sodium bicarbonate or sodium carbonate should not be used, or sodium hydroxide should not be used? Very good reasons are given in that Block and Roche inorganic chemistry. Then what others are used, that is example aluminum hydroxide, magnesium hydroxide, why they are given, what are the advantages of these, what are the disadvantages of these. These are very nicely given in the inorganic chemistry book, and same thing you might have studied while studying drugs acting on GIT in pharmacology. You refer this. Then the next thing is there, that various other agents which are there. So for that again your physiology studies will be helping you. Example, for all acid secretion, very important factors, as we have seen various phases, cephalic, gastric and intestinal. In that, one more important thing is that whenever there is a gastric phase, whenever the acid is to be secreted, what are the steps which are taking place, what is the physiology of acid secretion, and there you find that we have got numerous cells which are releasing, or mast cells type of cell, which we do not call them as a mast cell. Just a minute. हाँ परेश सर, हां चेक करून घेतो मी एक क्लास घेतला की मी एकदा सांगतो तुम्हाला असं. हो हो. So in that case how the acid is secreted, and you will find that histamine plays very important role. Histamine potentiate the activity of various agonists, and which are acting on, example, muscarinic receptor, acetylcholine is acting, and later there is gastrin is secreted, and there are various such neurohormonal agents are there which are secreted, which are there, but the presence of histamine causes multiple fold effect, multiple times it can cause, and because of that the acid secretion, we can have role of this various antihistaminic agent which are particularly acting on H2 receptors. So this is what basic thing I feel if you can have it, it will be helping you. The most important thing is why there are acid peptic diseases. Okay, let us start with the etiological factors. Etiology, there are many. Again, if you go for Ayurveda says that there are many reasons, particularly those who are eating too much spicy food, Those who are not following the routine daily activities, example, you will notice that if you fix the time, then at particular time, again this is related to cephalic phase. Okay, you just read cephalic phase very carefully in physiology, then you will realize that how it is important. So at physiological, this at cephalic phase, your physiology is adapted, it is accustomed, and that accordingly, whenever the time appears, then acid secretion starts, because even though you are not going for any kind of eating, this is what the cephalic phase is doing, that is at particular given time. So Ayurveda say that you maintain a time, you maintain a routine of eating, you give some time for digestion. If it is not digested, undigested food will also give some release of gases, and which will cause. So these are various reasons why the acid is secreted in excess. There are certain kind of foods which require more acid to get digested, they causes irritations. Some of the spicy food, they causes irritation. This is all physiology actually. So if you understand physiology and if you relate it with the etiological factors, then your understanding will be much better. So you will find that if you do not follow these cephalic phase timings, then the acid secretion will be imbalanced. At certain time it will be there, and when it is required it will not be there. When it is required, if it is there, then it is causing hyperacidity. When it is required, it is not there, it will cause indigestion, and both will result into problems of the GIT. And in all cases, whenever these problems are there, they are causing irritation, because this undigested food also can cause irritation, and that reflexly cause secretion of acid. So this increase in the secretion of acid, when it is more than when it is required, then it is causing the hyperacidity. This is the first step in the ulceration. Second thing I told you, again physiology, if you will see that there is always protective layer is there. That protective layer is of mucus and bicarbonate. These are secreted by various cells which are present in the gastric mucosa, and when this mucosa is not sufficient, then it will cause the irritation, and if this irritation persists, it will cause injury to the cell, and if there is a cellular injury, it will cause more irritation, because you can imagine that intact skin and wound, you will find the difference. So here if the mucosa is damaged, then definitely it will get more irritation, and more irritation means more reflexly more secretions. So whenever there is irritation, this is a very common thing which is there. Physiology will also teach you that there are certain aspects, example distension of stomach will cause, this is the gastric phase we call as a distension of stomach, or any kind of irritation causes increase in the acid production. So all these factors, when they will come together, that will cause increase in the acid secretion, and because if that is not, if the simultaneously food is not there, then it will cause, and it will, if it is more than the bicarbonate or the mucus, then it will act on the mucosas, and because of acting on the mucosas, it will cause irritation. This irritation may lead to injuries, that injuries we call them as ulcers. So this is the next step of ulcer. Second thing is, if you have seen earlier somewhere angina, that is we call it as an imbalance between what oxygen supply and oxygen demand. This is very best and easiest way to describe angina. Similarly, gastric ulcers are, there is an imbalance between acid production and the protection, because if the acid production is more than the protection, it can cause, or if the protection is less than the usual one, then it can cause. Now why there can be a decrease in the protection? Protection can be reduced because of certain factors. Most important factor is, in most of the cases, it is the infection. There are two strains of the bacteria which are very known for causing this, that is Campylobacter pylori or Helicobacter pylori, and this C. pylori or H. pylori, they are responsible because they thrive on the gastric mucus secretion. So they will develop over there. While developing, they will eat out, or they will consume the mucus secretion. Mucus is a thick protective layer. Because of that, it will be reduced, the thickness will be reduced, and because of the reduction in the thickness, the normal acid production can even pass to uh, the mucosal cells, and they can cause irritation, and subsequently they will cause the injury. So this is very common cause. So there are most important common causes are two. One is there is increase in the acid production because one or other reason. We can have several factors into it, and second is there is a reduction in the protective, and there are several causes for that. These are the basic etiological features for the peptic ulcers. Now what are the causes? I already told you. Dietary changes, dietary difficult, that is eating food at any time, eating food whenever not required, eating more spicy food, and not following the cycles particularly. Therefore it can cause acidity, because all of a sudden or there was food somebody has eaten, again somebody find that very good spicy something is there, go for eating it. So these all may result into more acid production, because it will cause irritation, it will cause distension, etc. So these are the factors which are causing increase in the acid production. There are the factors which are causing decrease in the protection. There are many factors. Example of this, prostaglandin inhibition, because prostaglandins are very, very important for secretion of mucus and the bicarbonate. So if we inhibit, how you inhibit it? You inhibit it with various NSAIDs. So NSAIDs can cause ulcers. If you go back and if you refer the aspirin, you will find that aspirin has multiple reasons why it can cause ulcer. That is, aspirin breaks down into acetic acid, salicylic acid, and also they are cause blockage of prostaglandin. So all these multiple reasons, they are therefore they are very much prone for ulcer causing. So these are the reason why NSAIDs causes, or many such drugs which can cause it. Some drugs are irritant, they will cause it. So either irritant drug, they will cause increase in the acid production, or the drugs which will cause decrease in the mucus and bicarbonate secretion, they will decrease the layer. Then second reason I told you that various bacterial infections like C. pylori, H. pylori, they will cause it. So these are various reasons which will be causing these acid peptic diseases. Now what should be the sign symptom? What are the drugs which are available for that? You may go for that. You can take this as an assignment. Those who can just refer and go through it, just go for physiology of this and pharmacology of physiology of acid secretion and pharmacology of various drugs. So you know you have various drugs which are available for that. Accordingly, depending on the activities, suppose it is detected there is H. pylori infections, okay, that is urea test is there. I'll let you know about various tests for H. pylori. These are the diagnostic tests which are there. Other diagnostic tools are there. You go for endoscopy, then hematemesis, that is in the vomitus, because of the irritation the person may cause vomiting. Because of the in the vomiting there may be blood is present, we call it as a hematemesis. And this hematemesis, even if the ulcers are too much, then it will cause, and particularly it becomes duodenal ulcer, then it will not come in vomiting, but it will go in blood, and there will be black stool, or the stool will have signs of presence of blood. So these are various reasons. These are various ways by which it indicates, it shows that the ulcers are there. Other symptoms are very clear, that is severe burning and painful sensation in gastric region. So all these signs, they will indicate presence of ulcers, and accordingly one can go for the treatment. Treatments are, as I told you, we have got very few drugs or limited drugs, and some of drugs are having adverse effects. So usually the treatment goes in a very clear way. Depending on the conditions, we have got the milder agents. The mildest agent in that categories are the antacids, that is inorganic antacids, aluminum hydroxide, then magnesium hydroxide, etc. These are the mildest one. Then slowly if we go ahead, then the drugs like H2 blockers like that is ranitidine, famotidine, nizatidine, all these tidines are there. These are the drugs which are given, and the most prominently given because they are having capability to stop any kind of acid production. These are we call them as a proton pump inhibitors, very popularly used nowadays for almost all conditions, and in all conditions rather they are becoming the first line treatment. So there are various first line treatment like omeprazole, rabeprazole, esomeprazole, and all such prazoles are there. So these are the drugs which are prominently there. In certain conditions one can use anticholinergics also, because acetylcholine plays important role through muscarinic receptor to produce acid, but unfortunately they have got many generalized side effects, so rarely they are used. Out of that, pyranezepine, telenezepine, they are comparatively more gastrospecific, and then they can be used in certain conditions. Then other drugs are there where there is inhibition of prostaglandin and you need to revive it. Then we have got prostaglandin analog like misoprostol, they can be given. So these are various drugs which are available for that, and these drugs can be given. These drugs are available for treatment, as I told you. And next is for the infection, that is Campylobacter pylori and H. bacteria pylori. The treatments are again very clear. Amoxicillin is the preferred one, but the best thing is there at again you can take this as an assignment, that H. pylori and sensitivity, culture sensitivity or bacterial sensitivity, because we know that bacteria they can form resistance to one or other kind of antibiotic, and then currently which are the most sensitive or the drugs, or which are the drug to which the bacteria are sensitive nowadays, that has to be checked routinely. So as usually amoxicillin and some of the ciprofloxacin, they are being used for that, and some of the other beta lactam like cephalosporin, these are the prominently used antibiotics. Various that is ciprofloxacin or this what we can say ciprofloxacin, ufloxacin, gatifloxacin. So these floxacins are there. Then importance are as I told you, amoxicillin is one of the important one, amoxicillin with clavulanic acid, and the important one is the beta lactam one, that is cephalosporin. These are quite popular, but if the resistance is formed, then other antibacterial can be used. So this is how we go for the treatment of various peptic ulcer diseases and the treatment for it. So please go through this. If you have any difficulty, you just let me know. There is no big thing into it, because acid production, various reasons for that, and the treatments. So treatments are that way limited, and as I told you, omeprazole is first line treatment in most of the conditions. So these are all ulcers, various kind of ulcers, peptic ulcers and duodenal ulcers. So these are ulcer diseases. Next time we shall go for two important thing, that is GERD, that is gastroesophageal reflux disease or reflux disorders, and next to that we will go for various colitis, that is ulcerative colitis, and we call them as IBDs, that is inflammatory bowel diseases. In that, ulcerative colitis and Crohn's disease, these two important diseases are important factors are there. We can consider this, and then we will go for the drug acting on various kind of liver disorders, and what are the example, liver cirrhosis, etc., etc. So this will be our next few lectures, how we will be going for that. You go through this various ulcers, various acid peptic diseases. As I told you, it start with the hyperacidity. Normal hyperacidity can be simply controlled with the inorganic antacids, but however if it increases, then the highest and the best medication, we have got range of it, and the best medication for that are omeprazole, esomeprazole, etc. We call them as a proton pump inhibitors. So this is how the range is available. If you have got any difficulty into this, please go through it. When we go for the next, again for GIRD also almost same thing is there, but if you have read it somewhere in pharmacology, what do you know about prokinetic drugs? So you just remember what are these, you go through this and let me know what are, I just need what is the prokinetic, okay, and which are the drug which are acting as a prokinetic drug, in what condition they are used. So I need this. Once you can find this, if you have difficulty you can ask, okay. So take care and let me know if you have any difficulty, okay. हाँ बोल जय जय, बोल ना जय, क्लास ले रहे हो तुम्हें।